Founded 5 years ago by Lillian Olubi, Drug Aid Africa has become a beacon of hope for communities across Nigeria.
I think it started as a result, I would say, as a confluence of many things that had happened in this particular season of my life. First of all was the loss of my mother. Following her demise, I was one day sort of looking at all the drugs that she had that were sort of going to go to waste. And these were pretty pricey drugs. And of course, I was thinking there are people who would need these drugs. And so I imagined that there was an avenue where people could donate drugs that they didn't need anymore. And of course, it happens many times when we have, even on a daily basis, when we buy medication and we don't run out of them. And I just imagined that there was something. And there was a bit of a quest for looking for these kinds of avenues to drop this medication that I had. And I saw that there wasn't any. I didn't come across any. Of course, I would later learn that that was a little bit of a difficult thing to do. But in the initial thought, it was that it would be nice if there was something, build of a structure of something that people could donate medication to, even if they were used, but properly interrogated and vetted. And I was curious to see how we could do that.
Lúwa Oyindamola, orúkọ community ní Ìdí-Àràbà community. Gbogbo iṣẹ́ tó ń ṣe mo dáadáa ní gbogbo ẹ̀ because àwọn oògùn tó ń fún wa ọ̀pọ̀lọpọ̀ àwọn ẹlòmíì wọ́n sick wọn ò rówó ra oògùn so wọ́n máa ń bọ́ sí time nígbà mi tó yẹ pé tí wọ́n bá gbé wá wọ́n máa ráyè lo oògùn yẹn. Nígbà míì náà àwọn pad tó wá ń pín bíbáyìí ẹlòmíì máa ṣe period kò ní rí owó ra pad.
My name is Comrade Olanrewaju Olusegun from Ìdí-Àràbà community. They have been an helpful hand to this community. I think far back as 2 years ago or 2.5 years ago. And I think they've been orienting people in this community about the real meaning of using one medicine.
Sort of at the same time, or in a similar time, I was also going through a bit of a challenge financially. And it was during the Christmas holiday, and one of the days when I was just sort of thinking through around what I wanted to do next and thinking about, building the base and gaining myself financially, I then just sort of thought of all the people that needed help in that Christmas and how privileged I was regardless of my financial situation. And I thought, I wanted to spend that time to give back. And so it was a case of the little I had, let me even use that to make some people happier. And I had an idea to just sort of go to a hospital, which, later on became Massey Hospital, to sort of give charity and do some nice Christmas hampers for children who were on admission. And quite interestingly, at the same time I was thinking about this idea, I had a close family friend call me, literally from another side of the world, who had been thinking of something similar, who is, of course, the co-founder now of Drug Aid Africa. And we decided to then do this work during the holidays in a bigger scale. And so he came on and we went to Massey Hospital, Massey Children's Hospital, and we had this Christmas deliveries of cash to parents of the sick children and of course some other gifts. It was then sort of subsequently thinking around just how we continue that support and also around this idea I had about, infrastructure for drugs and recycling drugs. And then we thought, this would be good for us to do properly, and let's just continue to support. And of course, being in Massey Hospital and coming one-on-one with the children and the needs, I think it was just very clear that there was so much to do on the drug side, that everybody deserves, a chance at healthcare, and that we could, I could mix those burdens I had together with the support of drugs that I felt people need, and of course, what we were seeing as the healthcare challenge. And so that was really how it started, and we said, let's do this. And so we started very easily with trying to just cater to some 6 or so prevalent acute conditions. And we had medical professionals join us on the board to think through what that structure would be like and how we can lend support. And that's how we started, really primarily supporting the Massey Children's Hospital with free drugs for 6 acute conditions. And then later on we branched to that same support to other hospitals and then eventually to different kinds of projects.
So we are partners with about 2 hospitals, Ali Moshood General Hospital and Massey Children's Hospital. It makes it easy to handle cases that we cannot handle at the community level. So for sickle cell patients, for example, any child that walks into Massey Hospital will get their routine medicines free of charge, and that's thanks to Drug Aid.
Over the years, Drug Aid Africa has forged partnerships with stakeholders, including government agencies, local NGOs, and international donors, to amplify its impact and reach more communities.
Massey Street Children's Hospital has a rich history. It's the first pediatric hospital in Nigeria and the whole of West Africa. And it has had a lot of the founding fathers of pediatrics work in it at one time or another. This particular building we are in is over 100 years old.
Drug Aid and Massey Street Children's Hospital have been together for almost 5 years now, if I'm not mistaken. Drug Aid has assisted Massey Street Children's Hospital in the provision of essential drugs for the period that I have been the director in Massey. Drug Aid Africa fill in the gap by making drugs available and accessible to our patients. They've really supported Massey Street Children's Hospital, and we are grateful for all that they've been doing with us. In fact, the last time, we were amazed at the quantum of drugs that they supplied to our sickle cell patients. On a monthly basis, we send them the list of patients that have accessed their drug, the phone number, the drug given, so they are free to contact the patient, and they are even free to go to their respective homes to make inquiry.
Accountability is key, So inventory is taken, and then good documentation by the store, the pharmacy units, as to how the drugs are being disbursed.
Aside from that, we have individual bin cards for their drug. So we have ledger for their drugs too, and a separate shelf for their drugs. There will be value for money. They are supporting us, but we are using that same drug for the purpose for which it was meant. And we are accountable. We send in their reports, and they can verify the report anytime, any moment.
Across states in Nigeria, Drug Aid Africa has left an indelible mark, providing essential healthcare services to the most vulnerable populations. Our focus is not just on providing medical supplies. It's about empowering communities to take charge of their health and well-being.
My name na Ibinolapo Sunday. My community name is Musafejo Community.
The second partnership will be the communities. They need to feel safe. They need to know that you're not using them for political gains. They need to know that you are there to actually help them, so they protect you, they provide some form of security.
The first day where I meet Mr. Sheib, it was somebody that introduced him to me that day. He told me that this is what they are doing and this is what they are. I said, yes, wow, we love it in our community. I am a community mobilizer before, so I told him that I can mobilize more people for them whenever they have a program in our community.
So I'm currently at Ilaje Ebute in Bariga. It's a lovely community, it's a fishing community, lovely people, beautiful people, and they're very welcoming. But it is one of those communities that Drug Aid has basically taken under its wing to serve. To ensure that effective distribution of medicines go on in this community and other communities, we do something we call a needs assessment. So is it malaria, is it eyes, is it dental, name it. So if they're, for example, suffering from a malaria problem, we start with sharing nets, mosquito nets, insecticide treated nets, malaria medicines, we do tests. If it's dental, we bring in experts, we bring in dentists, dental surgeons. If it's eyes, we do sharing of glasses, obviously after tests. And then every 3 months or 4 months, we endeavor to try to deworm as many children as we can.
My name is Edith Obatuga. This community is Ebute Ilaje community. In this community, we've tried a lot, like carrying out malaria tests and sharing of malaria drugs, sharing of mosquito nets, feeding like 1,000 people, and also carrying out the eye tests. Like after the test, they give eyeglasses, like the one I'm using is through the drug aid. Because when I went to the hospital to apply for recommended glass, they told me it's 30K, so which I couldn't afford it until drug aid come to our community. They gave me free of charge. I wasn't the only one.
I have this feeling that perhaps the most impactful part of our work we don't know. You know, there are many things that I've witnessed. Impactful times, of course, were early days in Mercy, seeing the children and the joy of parents who then had support to give to children that, you know, it was clear that they had no other means, and the lifeline that our support brought. There were times, of course, it was even with the project director in the middle of different supports with the eye care and dental care, finding out other problems that the people who were distributing help to had, and we then went back and said, let's do more for these people. And seeing that sort of trajectory is always very heartwarming.
Ó ní ọjọ́ kan tí mo sick tó yẹ pé àti rówó ra oògùn gan wàhálà ni, bọ̀ àwọn oògùn malaria tó máa ń kó wá yẹn ó bọ́ sí time ìgbà tí mo sick mo dẹ̀ lo ara mi dẹ̀ wà òkè.
Orúkọ mi ni Mrs. Chief Olúwalọ̀rẹ́mi Lúwà. Mo wá láti Ìdí Àràbà community. Oògùn tó ń mú wá fún wa ẹlòmíì ò ní owó láti fi ra àwọn oògùn yẹn. Ní 3 months tó máa ń mú oògùn yẹn wá fún wa. Òbí mi ò ní access láti fi lọ rà, ṣùgbọ́n nígbà tí wọ́n wá ń fún wa ó tún dín ìnáwó àwa òbí ó tún dínkù.
Very recently we realized that the people we're giving medicines to are also very hungry. The economic situation is not very helpful, so we decided to start something called Food is Medicine. We started at December 2023, where we decided to give the communities some form of uncooked food, cooked food in different communities just to assist.
When we first thought about it, when the program director recommended we do that, I was a little bit hesitant, and I thought, let's focus on our focus. We're about drugs. You know, I wasn't sure that we should go into, you know, the food distribution. And I'm very happy that we decided to. I was at the first iteration of that. Sort of seeing the impact of that program, I kind of felt, you know what, food is medicine. When you think about it, this is just, you know, such a need, especially with the inflationary conditions of the economy that we're in now. It's very soothing to see that we also have the complement of that aspect in addition to drugs, and that is always very impactful, seeing the joy in people's faces and the number of people that we can reach in that way.
I appreciate them for whatever they have been doing in this community as they are helping this community. Even the program they brought in the December period, it go a long way in this community.
In the past 3 to 6 months now, almost a year, we've not really seen deaths due to HBSS. They now come to their clinic regularly. They adhere strictly to their regimen because they are getting it free of charge and they don't have crisis. So this collaboration has made positive impact.
We're good ground. I'd like to say that there's a lot to do. Healthcare is important and the needs are enormous. And we really believe that everybody deserves a chance at healthcare. To us, it's the foundation upon which every other thing sits. You know, you do life from there. You have to sort of, you know, be well first.
The most fulfilling part comes when you see one person that's genuinely happy. So you could give 1,000 people things, you could give 2,000 people things, but then you see one person who is so happy. So that person moves you to tears and you're just like, I came for that one person, I'm happy, I'm done. Our journey is far from over, but with your support, we will continue to bridge hope and transform lives, one community